Hello, hello, hello. This is Kenny Perkins, aka your cancer guy. And again, as I always say, we have another phenomenal guest. Now, for those that are listening in, listen to me. Our next guest, she is from Chicago originally, right? But now she
Mhm.
is a Texan. She's someone who has migrated, but her migration always involves helping other people. This person is in the cancer industry. She's a physician. She is an oncologist, and she helps so many people to try to get them going, right? And you know what? There's a lot of people that have professions, but there's not a lot of people that's passionate about their profession, and that's a difference, right? There's people who work in their industry, and there's people who love what they do in their industry. And this next person, she loves what she does, and I am I have so much admiration for the things that she does. She's a mother, she's a wife, she's a professor, she's just getting it done. And listen to me, let's welcome our next guest, Ina Patel, to All Talk Oncology. Ina.
Thank you so much for having me. What a pleasure and a joy it is to be interviewed by you today. Thank you for
Oh,
being with me.
Ina, thank you. Thank you so much, Dr. Patel. Really appreciate having you here today. And I'm excited, because there's
Yeah.
so much going on. And
Mhm.
it's nice where people can tune in and hear a professional and get that opinion because as I always say, people in the medical field, they don't, it doesn't matter, right? It doesn't matter what you do
Right.
in the medical field, right? You could be in transportation, you can be a surgeon. It's like everyone comes to you because you're supposed to have all the
Yeah.
answers. So, you're looked at as like a superhero, to a lot of people on the outside. Sometimes we take those things for granted because we are in the field. So I'm excited to be able to pick your brain for those that are listening in, that you can help them on their journey.
It is definitely a privilege to be able to be in that role as what you do and what I do and my colleagues do to have so much trust in us from the population. Definitely. It's kind of a privilege, right? To think
Yeah.
about that. Yeah.
Yeah, I love that. It is a
Yeah.
privilege. Thank God we have the ability to do that and created the space. But it's
Right.
not only that creating a space is you love what you do. Talk to us. I mean, because you're a professor also, right? I mean,
Yeah, assistant professor. Yeah. So I love what I do. When you graduate from fellowship and you become an oncologist, which is a cancer doctor, you can practice in any type of cancer that you would like. And so I serve truly the community out in West Texas, so the underprivileged, as well as a large population of Fort Worth. And it truly is a passion of mine to bring to them all the trials and all the latest research advancements we have at the main center in the big city to them. And I'm so passionate about teaching my medical students and my trainees because we have got to get this younger generation that comes into medicine kind of start at a baseline with a sense of compassion and passion for this. And those are my two things, and breast cancer certainly sparks that as well.
yes.
Yeah.
That's I love that. I love that. I love that whole outlook. I love that whole approach. And you're in a position to do it. Being a
Mm.
professor, you're in a position to do that. So thank you so much.
Thank you.
Yeah, for sure. You know, what how did you decide that you were going to go get into oncology? Because that's not something everyone does, right? I mean, oncology is a very specific niche in the medical field. How did you decide upon doing that?
It's really interesting and a good question. I actually, even to go further back than that, I decided to just be a physician in general when I was 5 years old. So nobody else in my family is a doctor except me. So I'm not just the first female doctor, I'm the first doctor, period, in the family.
Right.
And when my parents and I came from India and I was 5 years old, I had an amazing pediatrician. And even though my parents didn't speak English, didn't have a lot of money at all, he treated them with so much respect and compassion. And I was like, I want to be like him. Like this is it for me. At 5, I declared that I would do that. Then when I got into high school, our high school was right across from a major oncology hospital for children in Chicago. And I said, I want to start going there. And so I got involved in child life specialist work there with cancer patients that were children. And it was this spark in me that kind of just brought out this innate sense of compassion that I have for people. And then, of course, the nerdy science, right, that we all love in medicine as well. So that's what started my journey in oncology was really early on in high school. And as I did more and more rotations into residency, I think adults really was where it was at for me. It was like I could make a one-on-one connection with an adult for oncology. So that's why I chose it, and I haven't looked back, and it sets my heart on fire. I was blessed to find a profession that actually matches what I want to do, so.
And that's powerful,
Mm.
because for those that are not into, not in the profession of the medical field, understanding oncology, it is a lot about connection, right? Because
Yes.
Dr. Patel, you can add to this. We're meeting people in their most vulnerable stage in their
Mhm.
lives, and to be able to form a connection with someone who you feel that you can trust and it's going to take care of you, you can feel that sense of sincerity. It's important, would you say?
Absolutely. From the moment I walk in the door with my first patient of the day, within 5 minutes of seeing them, either I'm holding their hands and saying, "This is going to be a really rough journey, but I got you. And we have a good plan and we're going for cure." And you could see them just kind of in all the tears and all the release. Or sometimes it's, "Hey, we're approaching a rougher part of your journey, and your scans look like the cancer is getting worse, but we have some options to make you more comfortable as this journey goes on." And that sense of relief when the caregivers are in the room is palpable. You could almost like feel them being like, okay, it's bad news, but we also have someone to walk us through that. And Kenny, that's within just like 10 minutes of coming into work. So
Yeah. Yes.
that's the emotional roller coaster throughout the day that we join with
Yes.
patients. Yeah.
I love that. I love that because that has always been the approach. And so to listen to you and the mirror that, I love that because you
Yeah.
know what? It is people can trust
Yeah.
honesty, right? They know when they're being told the truth and they know when, people are just beating around the bush. And
Yeah.
sometimes people don't know how to give the truth in a palatable way,
Yeah.
right?
Right.
So so thank you. Thank you for what you do, and it's a gift, really, and I need you to know
Oh,
that.
thank you. Likewise. Same with what you do as well.
Yeah. So you see all kind of patients. Walk us through a day of Dr. Patel and, how you go about moving around.
As a mother and as a physician, my day starts very early. And I'm blessed to have a partner and a husband who makes this possible. So I wake up early, and within 40 minutes, my husband and I get up and we get the kids ready. We get them, give them the milk. We say prayer every single day in the morning. So we spend about 10 minutes saying prayer together. And then we get them ready, we walk the dog, and we're out the door to daycare. My husband takes them to daycare, and I start driving over to work. And it's an hour drive from my house to get to my clinic. I walk in the door, and the first thing I see in the morning are patients waiting for their labs. And you could just see them locked into their emotions. They're just sitting and waiting for their appointments. That's the first thing I see when I walk in. And it kind of just makes you put things in perspective of all those little things in the morning that I may gripe about, like traffic and getting the kids ready. I walk in that door and I see those patients waiting for their labs or their first cancer treatment, and it just melts away. And I say, don't sweat the small stuff. Then I walk into clinic, and typically, my first few patients are already there in the rooms waiting for me, and some of them are new to breast cancer. So I'm walking in with the fresh diagnosis of breast cancer. Some of them are already on chemo and they're about to get their next treatment. Some of them are there to talk about their scan results, and scan anxiety, as you talk about, is very high. And then there's some that are progressing, and we need to start talking about making them comfortable. So there's a lot of variety in the morning. We are never boring in oncology, right? But it is truly, it just carries you the whole day because it's a very heavy day throughout the day. So that's kind of a typical day, and it goes to the maybe 5 o'clock hour. And I get back in my car, drive another hour, get the kids, and here we go again, second shift, right? And so we bathe them, feed them, pray, and put them to sleep.
I love that.
Yeah.
I love that. Your morning routine is very powerful, and I love how you just break it down, and there's so much detail in that. And so, listen to Dr. Patel. If you guys are listening in, you know, to have someone waiting for you, or to coming in to see you when you come in as a visit,
Yeah.
just taking care of you. It's important that they have that right mindset. And then
Yeah.
you listen to Dr. Patel, she's ready. She's ready to take care of everyone there. And Texas is a big state, Dr. Patel. It's like, man, I can only imagine the population, and then, the amount of patients you see. You
Yeah.
must be busy.
I am busy. When I started 5 years ago out of fellowship, I had zero patients when you start your own panel. And now I have 4 days straight of a full clinic of patients, morning and afternoon. And I built that over the course of 5 years with having two children in those 5 years. And I'm blessed because I see people all over from Texas, but also they come to us from like surrounding states like New Mexico, Oklahoma. So if there's something drivable distance, they will come to us because we offer clinical trials and advanced research and things like that as the kind of sister to MD Anderson out in Dallas, Fort
Yeah.
Worth.
Yeah, that's awesome. Because getting diagnosed, it's already overwhelming because there's so
Yeah,
many misconceptions about cancer. And
yeah,
so all you know is what you see a lot of times, or maybe you've heard of someone who someone else knows, or you may have known. And but
right.
not all cancers and all diagnoses are the same. So um you know I can imagine what you deal with when you're dealing with different individuals, right?
Yeah, definitely. And breast cancer really, I think what people should know about breast cancer when treating it, why it's so different is because, yes, men also get breast cancer, but majority of them are women. And when you're treating women with breast cancer, you have to understand like they're the bread, the glue of everything in that household, right? They are the people that hold things together. They are the people that are emotionally composed. Everyone goes to them. So when they have a breaking point, it's very hard for them to emotionally release and like be their true self because they're just holding it together for everybody else. But what's really interesting is when they're with me one on one, the tears come down, the vulnerability is there, and I create this open space for them to say, it's all right, because you and I know what you're going through. And I know the moment you walk out of here and you get in your car, you're going to put on your face for your family. And I know that, but it doesn't have to be that way. And so that's a very unique thing that you deal with when you treat breast cancer is the women that you treat are heads of their households, right? And they're trying to hold it together for everybody else. So you're that person they can go to just be their authentic self, basically. Yeah.
Yes. Well, I mean, you have touched on something very, very deep here. And honestly, I want to give a shout out to all the ladies out there, the women
Yes.
that are going through, cancer, breast cancer. You guys are the head of your household, and sometimes that gets overlooked um, by those around you. And so I want to pause and just say thank you so much for your strength, for your resilience and
Mhm.
tenacity. Going through something like this may not be the easiest, but when you have a healthcare team that supports you, like Dr. Patel, um, and it makes things easier. And thank you guys so much. Thank you guys so much for tuning in to All Talk Oncology. We're going to make sure we continue to bring the best to you, Dr. Patel. Man, that touched me in such a way because I was raised by my mother, my father was around, he's
Yeah,
around. They were just divorced, but, I live with my mother, and so
yeah.
to know what she had to do in order to
Mm,
keep me out of trouble, keep me fed, keep me clothed, and then at the same time, try to take care of herself and be that strength. What a man, it's
mm,
a lot to juggle. So thank you so
mm.
much for bringing that out.
Absolutely. And, that's amazing. And it speaks to your success. And I'm sure she's so proud of you, right? And everything that you have done. And that's the thing I recognize, right? Like, I did not grow up with wealth at all. My parents came from India and they raised us and they made something out of that American dream. And a lot of my school friends and things like that, a lot of them didn't have parents. There was a foster care place that used to send their children to class with us. So we shared, it was a public school in Chicago. So you could imagine, right? We saw everybody. And those moms and single dads too, like what they go through on a day-to-day basis is hard enough as it is, like financially keeping the household up. And then as a woman trying to raise a young boy, a man in this world, and or trying to raise women, young girls in this world is hard. And then you throw cancer into that mix. That's next level testing of your patience and your faith and all of that. So I really recognize that because some of my patients don't have anybody. Like, some of them don't even have children or a partner, it's just them. Or some of them are single parents. And I always keep that in mind when we treat them to check in on their mental health.
Yeah,
Yeah,
it's so important.
yeah,
We deal with the patient and we want to make sure we treat them, but that mental health is also a huge factor.
yes.
And I'm going to ask you because we're talking about ladies, and we automatically assume, right? I mean, when you talk about ladies who have a household, who have kids, they're a certain age in our minds. We automatically put
Right,
them at a certain age. Okay, these are ladies are this old, or they're in their 40s or in their 50s, or
right.
whatnot. But I want to ask you and to talk to you. Let's talk about ladies who are getting breast cancer or getting diagnosed with cancer at an early age. Are you seeing a lot of this? And if so, what can you say to those that are listening?
Yes, I appreciate you bringing that up because that's my biggest area of passion and research and interest is the adolescent young adults that we call the AYA population. These are people that are between the ages of 15 and 39. And it is alarming the rate at which we are starting to see breast cancer in such a young population. So, when we think of breast cancer and we see the posters of Susan G. Komen and things like that, we used to think of women in their 60s, Caucasian women in their 65-year-old kind of posters. And now, within the last 4 to 5 years, you see girls as young as my youngest we treat is 22. So 22 and up, and all different races, backgrounds, socioeconomic background. So when I give presentations, I show a picture of that 165-year-old lady 5 years ago to another picture that has like 10 different women, different ages, different races, holding up a card that says when they were diagnosed. And it's alarming. It's 30s and 40s. So, and the other really important key point I want to share with everyone today is not only that younger women are getting breast cancer, it's more advanced breast cancer. Like, the tumor biology is more aggressive. And we say, 2/3 of women that are diagnosed at a younger age have more aggressive cancers. It's stage 2 to 4 versus 1/3 of women who are older when they get diagnosed with breast cancer. So it's alarming that they're younger, but the cancer is also more aggressive now that we're seeing.
Yes. And it's alarming, right? I mean, you're getting younger people that are coming in and going, "My
Yeah.
goodness." And I've also seen that shift also, right? I mean, I've been
Yeah.
doing this for 2 decades, and you start to see, man, there's a lot of younger people coming in here. It's like,
Mhm.
am I getting older? No, 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 there's really they are. They're just really getting they're coming in at a lot younger
Mhm.
age. And,
Right.
you know, we can get into that, right? I mean, we can talk about
Yeah,
what that may be, the environment, the foods, or whatever we can come up
right.
with. But how do we bring awareness more? I mean, because I want to talk about that. And this
Yeah,
next transitioning into, we understand that this is a young population that's being diagnosed.
yeah,
How do we bring awareness to that, not only to the young, generation, but in general? How do we get that going?
yeah. Absolutely. I think that often when you're so young, a lot of people actually don't have insurance when they're like 20s coming out of college and they're not under their parents' insurance anymore. A lot of people are not even financially stable yet, like they haven't had their career choice yet. And that's one thing we deal with because if they don't have that, then many of them don't have a primary care doctor. So, let alone get a mammogram, they don't even have a doctor they're seeing once a year. So the awareness comes in saying, you have to take your health seriously and you have to prioritize like healthcare for you to make sure at least you get a primary care doctor. Start there. And for women, please get an OB-GYN doctor as well if you can. And your preventative screenings are covered, like a mammogram or a pap smear. That's very important. And if you do not have those things, and even if you do, you still need to be doing your self breast exams as well. There are a lot of women that detect something without the imaging. And so that's what I want to spread awareness is to all the men and women that are listening, for your children, your brothers and sisters, your mothers and grandmas and neighbors. You need to spread awareness about that hey, like breast cancer is on the rise. It's happening in a younger population. If you feel something, a lump, pain that doesn't go away after 2 weeks, make sure you see somebody. And that's part of why I'm trying to spread awareness, actually. That's why I started my social media account, is to say, how do I bridge the gap between all this complicated science stuff we talk about in oncology to the actual population and how they would understand it? So that's actually what you and I do, right? Is to bridge that gap to spread awareness.
Yes.
Yeah.
Thank you so much, Dr. Patel. I mean, I hope you guys are listening. You
Yeah.
know, it's important that you do some type of self-check. If you
Yeah.
are within that gap where you got not from the umbrella of your parents' insurance, or you're in college, or you're
Right.
just transitioning in life, right? Because life does that to us, right? We
Right.
transition. Don't forget yourself. And I want to stress that, because self-care sometimes goes out the window. But
Mhm.
we need to make sure we take care of ourselves, because there's only one of us, and you
Yeah.
matter. And you're an individual that, what? A lot of people care about you, you know.
Yeah.
And so, Dr. Patel, what are some self, you mentioned quite a bit. Make sure you find a primary care, get those pap smears, things like that. But if there's
Yeah.
some self tests that these ladies can do, or and men can do, whatever they may, something that doesn't cost them anything.
Yeah. So, there's a couple of things. The self breast exam is something where they're in the shower and they can just feel around on both breasts to see what is the usual feeling like. So that one day, if God forbid they find a lump, they know that it's something different. And that is when they can get linked in, usually through their county hospital if they don't have insurance, or there are a lot of mobile mammogram programs. We have a huge one in Texas. So, where you call them up and they actually will have you come in to do testing. But to dig deeper into that, younger patients tend to have genetic mutations. So basically, they were born with DNA that made it likely that they would get breast cancer because it was passed down in their family, right? So, another thing you can do is talk to your primary care doctor to say, can they test me for genetic testing? And that should be covered if you have a strong family history of breast cancer. So, that's another way to do it as well.
Yes. And if for those that are listening and you're going, oh my God, that sounds so scary. It sounds so big. Genetic testing,
It's a blood test
it's a blood
or a
test.
swab of your spit.
Yes. Yes. And so it's that simple.
Yep.
It's that simple. I don't want you to get frightened when you're talking about genetic testing. It's this whole process. No, it's very simple. It's a swab of
Just a
the
blood
mouth
test.
or it's a blood
Hmm.
test, right?
Yes,
So, thank you, Dr. Patel, for bringing
of
that up.
course.
Yeah, you know, Dr. Patel, you are a busy woman, and she's not going to tell you. Listen, Dr. Patel and I were having a conversation, and not only is she a physician, she's a wife, she's a mother, she's a doctor during the day. She also teaches. She's a professor, assistant
Mm.
professor. She's busy, and but you can see where her heart is at. Her
Mm.
passion is for the things that she does, and we really don't want her to burn out. But we love that about you, and so
Oh,
want to
thank
give you
you.
those accolades, right? They say give them their flowers while they're alive. I want to make
Oh,
sure
I
you get
love
your
that. I love
flowers,
that saying.
right? For sure. You know, but here's another question. As professionals, you and I, how are you seeing a lack of um I don't know the word I'm looking for, a lack of education to other professions, or excuse me,
Yeah, other
to other
colleagues of ours.
right,
Yeah.
as far as giving that awareness to their patients,
Yes,
what
yes.
can you speak on that a little bit for us?
Absolutely. I actually would love to speak about that. So I give a lot of like grand rounds talks to other hospitals about this as well, because the thing is when, women, young men or women go to their doctor and they report a breast lump, when they go to their primary care doctor, OB-GYN doctor, any other specialist, they often will say, it's a clogged milk duct. Oh, it's fibrocystic changes. Oh, it's mastitis or an infection of the breast because you're breastfeeding. And it often gets dismissed. Or they go to the ER and they complain about this breast pain and it gets missed. So it is so important for us to acknowledge that as physicians, I really all want you to know that if you have a patient that comes in and has this new finding and they report it, that you really make it a point to acknowledge that and order the appropriate testing. Because, yes, 20-year-olds also get breast cancer. And back in the day, that wasn't a thing to think about. The culture in our physician society was, hey, you're too young. It's probably fibrocystic changes, right? And even during pregnancy, it's alarming. Women that I see who had pregnancy with the mass, and they thought it was their developing breast tissue or their milk ducts or it got clogged. And OB-GYNs as well don't often will think, oh, well, that could be breast cancer. They're thinking that's part of the development and the trials and tribulations that we go through during pregnancy. And it's only after that lump gets bigger that we image it and we say, wow, that was actually breast cancer. And so think outside the box to our colleagues. And I just want them to know that give your patient the benefit of the doubt. If a man and a woman tells you something doesn't feel right, it's different, they are telling you that diagnosis. You have to acknowledge that and say, let's work it up. Let's do an exam, send you for a mammogram. Let's start there. And if we do that, that's really powerful in being able to detect these cancers earlier. And as you and I know, the earlier you find this, the better your chances for cure.
Yes.
So,
Thank you. That is powerful.
yeah.
Don't dismiss. That's the 100% message here. Don't
So,
dismiss. A lot of young people are getting cancer today. It's not
yeah.
an old person's disease.
Mhm.
That's a misconception. Don't, as Dr. Patel was saying, don't dismiss this as something else. Take the time to say, I'm going to check this out. That's it. That's it. That's what we're asking as healthcare professionals. We want to do our best. We want to do our
Right.
job so that we can give the patient the best possible outcome. So thank you so much, Dr. Patel, for talking about
Absolutely.
that.
Yeah, absolutely.
Yeah. Well, Dr. Patel, listen to. I mean, it's my honor to have you on here. I know we're
Thank
here.
you.
It's a holiday, but everyone. I mean, it's Easter Sunday. I just want to put that out there. I don't normally tell you the dates and things like that, but Dr. Patel's here on a holiday, giving me her love and giving
Oh,
you guys the love so that you guys can benefit. So, before I let you go, I just want to say, is there anything you would like the patient or the caregiver or the loved one or any healthcare provision to know and walk away from this video?
yeah, a couple of key points for my colleagues, our colleagues in medicine. But before I say that, thank you again for joining me on a holiday that's so special as well. I appreciate your time as well. But for our colleagues, I would say that, just be aware that younger population is getting breast cancer, and so is the older one. But please pay attention to what those patients are telling you. It really is a matter of life and death. Like, you really could catch this early enough to cure it. And so, for my cancer survivors out there, I just want you to know that Kenny and I seem to be very similar people in that when you come to see us, we see you so much more than just a patient with cancer. We grow to know your story, and you can lean in on us to be your social support and show that vulnerability because we know at home you might not be able to. But that's what we're here for, is to create that space for you to let things out and lean on that family and friends around you. You don't have to do it all yourself, and that will make your journey so much better. And so that's what I want you all to know, is that Kenny and I are here virtually as people for you, of course, but certainly your oncologist, your radiation oncologist, and your surgeon. Those are folks that are kind of like your team. You're our football player, you're our quarterback. You tell us how you want us to play your game, and we will do it. We will follow through for you. And that's what I want you to know. It's that we're not just like that doc that you go see every once in a week for treatment. It's so much more than that. But we're rooting for you to win.
I love that.
Yeah.
Dr. Patel, you are amazing.
Oh,
Thank you so much.
my
You
pleasure.
you hit the nail right on the head, and you know what? I hope you guys felt that because I did. I mean, it's goosebumps when you find someone who really cares and the giving up of their time. So, thank you so much, Dr. Patel, for joining us here today. Thank your family for allowing that, and I hope you have a wonderful rest of your day.
Well, thank you for having me. And Kenny, you really are a trailblazer in this space, to be someone who has brought on a platform to talk about something so important. I think you probably aren't even running out of topics to go over on interviews because there's so much to discuss. So you are really trailblazing this space of social media connecting to cancer awareness. And so I congratulate you. I encourage you, Kenny. I wish you the best of luck in your business and your podcast. And, I'm happy to always come again sometime and give you updates. Always happy to do that. Thank you for having me.
Yes, thank you. Thank you. I want to pause and say thank you for that. And that's very touching and it's very appreciative that you recognize those things. And number two, yes, I want to bring you back because we want to talk about clinical trials, right? I mean, that's something that a lot of people don't know that are out
Mhm.
there, and some of them, I know you mentioned that you do clinical trials, and I think that's something that people need to know and how to find them, right, and go
Yeah.
about that. So I would love to bring you back.
Absolutely, absolutely. I would love to talk about it. Not to take too much of your time, but clinical trials truly are something that can truly save your life. And people think of it as an experiment. It's not. It's not. It's actually so much more than that. And so we should definitely talk about that. I'd be
Yes,
happy.
thank you.
All right. Well, you
Yeah.
take care.
Yes. Listen, I want to thank all of you guys for tuning in. We had Dr. Patel. She gave it a phenomenal interview, and I hope you guys are walking away with the gems that she dropped today. She did not leave anything on the table, so I hope you guys can glean from all of that. If you were hungry, listen, for information, she gave it to you today. So listen, all of this is for you. It's for your caregivers, it's for the family members, it's for the person who's going through this journey. We want you to always know you're not alone in this. We're in this together. This is Kenny Perkins, aka your cancer guy. And until again, I'm out.
So stay connected with us on All Talk Oncology Cancer Podcast. Make sure you subscribe to that, right? Wherever you listen to your podcast, whether that's Apple, Spotify, make sure you subscribe and continue to spread that word, right? Engage in this because your engagement can help someone stay alive. And this is what we're talking about. So again, make sure you subscribe, hit that subscribe button. Again, this is Kenny Perkins, aka your cancer guy. Until again, I'm out.